Well, the battle against the coronavirus is not going to be ending anytime soon. If you've been following the numbers, you know that not only are the numbers in the United States in general really not looking good, disproportionately so, of course, among the unvaccinated, but we also have some states that are at their pandemic peaks now. They are at pandemic peaks now in terms of daily cases. They are in pandemic peaks now in terms of total hospitalizations, and the death numbers are going very much in the wrong direction. Again, mostly unvaccinated people. But there is this question of what about the vaccinated? Because there is no question that we are seeing breakthrough cases, which are mostly mild, but we're seeing breakthrough hospitalizations as well, although relatively fewer in number. And we're seeing breakthrough deaths as well. And there's early data from Israel showing that it starts to seem, it seems as though it starts maybe around 5, 6 months. And then there's a noticeable drop off at the 8 month mark, that there is declining efficacy in these vaccines. And so the question of a third booster dose has been raised over the last several weeks and months. And we now have heard from the CDC. The U.S. will begin wide distribution of COVID booster shots next month, saying vaccine protection wanes over time. There's a good write-up about this on CNBC. And these are third doses for people who have already had 2 doses of Moderna or 2 doses of Pfizer, like I and many of you in the audience have as well. The article writes, the U.S. will start widely distributing COVID booster shots next month. As new data shows vaccine protection wanes over time, top U.S. health officials announced Wednesday. It is now, quote, very clear that immunity starts to fall after the initial 2 doses. And with the dominance of the Delta variant, quote, we are starting to see evidence of reduced protection against mild and moderate disease, according to the statement signed by CDC Director Rochelle Walensky. Let's go now to Rochelle Walensky speaking yesterday and listen to what she had to say.
Through the end of July and early August, 3 points are now very clear. First, vaccine-induced protection against SARS-CoV-2 infection begins to decrease over time.
Now, important, she's talking there about infection. Now, next, she will talk about the other elements.
Second, vaccine effectiveness against severe disease, hospitalization, and death remains relatively high.
Yes.
And third, vaccine effectiveness is generally decreased against the Delta variant. So let's jump into the data. On this slide, you will see 2 studies, one from New York and one an analysis of data from the Mayo Clinic. From May 3rd through July 25th, New York examined COVID-19 tests and linked them to individuals' vaccination status based on the state's vaccine records.
This is huge.
This allowed New York to study vaccine effectiveness against infection over time for more than 10 million New Yorkers of all ages. Vaccine effectiveness in May, early during the vaccine rollout in the state, was 92%. In the later months, further from vaccination, vaccine effectiveness declined to 80%. These data will be published in the MMWR today. The Mayo Clinic analysis looked at vaccine effectiveness for both the Pfizer and Moderna vaccines.
So what is the point here? The point here is over time, efficacy wanes. And there's really 2 aspects to this. And this is we don't know the answer to this, but this is a really important thing to understand. The efficacy in the real world is in part waning because the virus variant that is dominant now is not the one that the vaccine was developed against. This is different than vaccine efficacy goes down against the live variant, the original variant against which the vaccines were designed. It may or it may not, but we don't yet have reason to believe that. And so this may well become like a flu shot type situation, where I'm scheduled to get my flu shot in a few days myself. The flu shot I will get in a few days is based on what was believed to be the dominant strain at the time that this year's flu shot started to be developed. I don't know if it's 6 or 8 months ago. And depending on how well that matches what's actually out there in this upcoming flu season, I will have a lower or higher degree of protection. And similarly, when we talk about the COVID-19 vaccine, the same question applies, which is how closely does the variant that is dominant match what the vaccines were designed for? So this is where we are going. And the guidance, as far as we understand it now, is going to be starting 8 months after your second dose of the Pfizer or Moderna vaccine. For me, I received my second dose February 26th, so I would become eligible on October 26th. And if that's the case and the vaccine is available, I will go and get a third shot because I want to not only protect myself, but protect people around me. There are, of course, people who have not gotten any vaccine and don't plan to, who are going to take this as an opportunity to say, now I'm definitely not getting the vaccine, even though they already definitely weren't getting the vaccine, because they will say this is just part of the plot to get us more and more and more doses forever. Well, when something becomes endemic like flu, that's the way it will sometimes work. And that's the way it does work with flu. So, of course, people who want to see a conspiracy will see one anywhere they want. They will see it in evidence and they will see it in the absence of evidence. And these are not really good faith actors that we can deal with in any serious way. But this is where we are right now. And many people are feeling, and understandably so, will this ever end? Like, is this ever going to go away? And the answer is, it may not ever go away as an endemic thing that is just circulating with peaks and valleys, sort of like flu. But if we get enough people vaccinated, and eventually it seems likely we would have a reformulated vaccine tailored to maybe the Delta variant, maybe to a variant that is still sometime in the future, we can get it under control from the standpoint of it being a pandemic. But certainly, things like masks on planes have been extended until January, at minimum until January. We are starting to see vaccine requirements at increasingly in different cities and states, to go to restaurants, to go to indoor venues. This stuff is not going to end anytime soon. And of course, part of the reason is a whole bunch of people still are not interested in getting vaccinated. At least one doctor, and I'm going to talk about this next, is saying he will no longer treat unvaccinated patients. When we're talking about sleep, we always hear about how much sleep people get, but often neglected in the conversation is the quality of that sleep, which is just as important. And science shows that lowering your body temperature during sleep can help you be more rested and achieve better sleep. And that's where our sponsor, Chili Sleep, comes in. Chili Sleep makes customizable, climate-controlled sleep solutions to help you improve your sleep. Comes in two varieties, the Uller sleep system and the Cube sleep system. That's what I have on my bed. Both are hydro-powered, temperature-controlled luxury mattress pads. You can make your bed as cold as 55 degrees. I choose 60. You can make it as hot as 115 degrees if that's your thing. I don't feel hot anymore at night. No more sweating. I'm sleeping better and I love it. I also have the Chili Sleep Chili Blanket, which helps keep me cool on top as well. They'll give you 20% off everything when you go to chilisleep.com/Pacman. The link is right underneath this video.